you for joining us today. Thank you to both our panelists who've submitted papers and our participants who are joining us from the conference. My name is Michaela Patrick, and I'm a researcher with the Global Disability Innovation Hub, which is based in London in the UK. So we're based at UCL, but we are also a research and practice centre. So we are working on disability innovation and inclusive design worldwide. So just before I introduce the panel itself, I just wanted to mention that for accessibility, we do have a live transcript today that you can access at the bottom panel in your Zoom. There should be an option to click CC, and then you can access the transcript. I'd like to ask all panelists to speak slowly and clearly to make sure that the transcript is as accurate as possible. And we're looking forward to the discussion today. So as a brief background to the panel, obviously here today, we're here to discuss inclusive planning for more just urban spaces, starting with disability. So the idea and the inspiration, I guess, for bringing this panel together came about through a program of work that's been delivered by both GDI Hub and the Development Planning Unit at UCL through the AT2030 program, which is a UK aid funded program looking at getting life-changing assistive technology into the hands of people that need it. So this is a huge program that's done a whole series of pieces of work around disability, assistive technology, inclusion, inclusive design. And what's been interesting is that multiple strands of the work, the part led by Julian Walker, my colleague who's convening the panel with me today, and myself at GDI Hub, is that we're finding similar conclusions. And one of the emerging findings has been how crucial inclusive planning is as an enabler to improve the lives of persons with disabilities worldwide and people who are using assistive technologies. So we were really keen to bring this panel together to discuss what are the key parameters for inclusive planning and really, take that from the starting point of disability, because what we have found is that if we design with a disability inclusive lens, it also has wider benefits for other disadvantaged or marginalized groups. So there are huge benefits to disability inclusive design and planning, and it should be fully integrated into urban planning process more broadly. And I think we'll be hearing from panelists today a bit more about that and ways to be doing that. So in the panel, we kind of focused on two key areas. So the first was around how we can look at the actual tools and mechanisms and technologies that we use in planning and how we can ensure that those are disability inclusive and accessible for everybody to allow participation in planning processes. And secondly, we were looking more at the governance and participation side of things and making sure that we include people with disabilities in planning from the start and make sure that co-design processes are genuine co-design processes and that people with disabilities are what we would call agents of urban development, so clear participants and agents and actors in urban development. I will now hand over to Julian Walker, who can introduce himself, and then he will move on to introduce the panelists. Thanks.
Hi, just quickly, so I'm Julian Walker. As Michaela said, I'm an associate professor at the Development Planning Unit in University College London, and I've been working with Michaela on the AT2030 research programme. So just to hand over now to the panelists, we have a bit of space. I hope you've all seen all the short presentations, the videos, and all seen each other's. We just have a little bit of space now for each of the panelists to make a 2-minute pitch, i.e. just quickly highlighting what are the main messages that they wanted to get across in their presentation and what are the sort of key provocations that they wanted to communicate. So we're just going to go through with 2 minutes for each of the panels, and I'd like to start with Pong Cruz from World Enabled. So handing over to you, Pong.
Thank you very much. If you want policies in areas like health, housing, or ICT to be effective, you need to be more collaborative. Whether you are advocating for policy changes or trying to make environments accessible for everyone, you need to work with people who have the skills and knowledge to get the job done, like people with disabilities or older persons. And whether you are a public or private organization, being inclusive in your policy process is key. When G3ICT designed, developed, and deployed the Smart Cities for All toolkit, it worked not only with private organizations, but also with human rights activists, with disability rights activists and experts, and of course, organizations of people with disabilities. And because of this, cities like LA, Quito, and Istanbul have used the toolkit to make their ICT procurement accessible. Other cities like Quito, San Paulo, Gran Valparaiso, and Santiago have also been using the toolkit to make their sidewalks accessible for everyone with the help of artificial intelligence. In Asia, the Association of Southeast Asian Nations have rolled out, together with the OPDs in the region, the Enabling Master Plan, which is the regional plan of action to mainstream disability rights. So local governments like the province of Camarines Norte has developed its own local Enabling Master Plan, which also helps them work with the Ministry of ICT to make public services for employment, education, and health accessible for all. The message is very simple. If you want your policy to elevate, you need to collaborate. Thank you.
Thanks very much, Pong. Perfect timing, such a tight 2-minute pitch. So now if we can move on to the next presentation from BRAC, and I think we have Rifat Sharpa Khan, who's going to be talking on behalf of the BRAC team. Did Rifat drop off the call? I don't see her now.
No, she's muted.
Oh, there we are. Sorry, she's unmuted.
Okay. Hello, everyone. It's a pleasure to be here and discuss our paper titled Challenges in Seeking Healthcare by Persons with Disabilities During COVID-19 in Bangladesh. In our study, we tried to explore the experiences of persons with disabilities accessing healthcare and the specific barriers they faced due to COVID-19. I heard Paul about saying utilizing different types of assistive technologies. Unfortunately, the 60 in-depth interviews we conducted, a vast majority of them had no access to phones. Internet is very costly for them. Smartphone, they don't have. So this is the story of another world. 21 KIIs were conducted, and we actually conducted these interviews in distant mode because it was conducted during the COVID situation, during heavy lockdown. And we covered 7 major types of persons with disabilities. The findings we have identified include persons with disabilities faced various challenges accessing healthcare during COVID-19 in Bangladesh. That includes rehabilitative services were shut down for a long time. Many services, including counseling, psychosocial counseling, went online, but many of the persons with disabilities actually didn't know. Many of them couldn't afford to access those. So that is the reality. Precautionary measures related to COVID-19 were not accessible for all types of disability, and children are included. Children with disabilities are also included. There are communications barriers between the healthcare professionals and persons with disabilities affected with COVID-19 in the healthcare centers. Even many vaccination centers were not physically accessible. Although healthcare providers tried to accommodate these problems, but they had to come out of the centers to vaccinate some of them. And that happened only when they came to know about persons with disabilities were in the queue. Many families deprioritized the healthcare needs of persons with disabilities due to financial constraints during the pandemic. Increased transportation costs made commuting to healthcare centers even more difficult. Most of the transportation services available in Bangladesh are not accessible. In fact, almost none of them are accessible. Persons with specific types of disabilities had faced unique types of disadvantages. Intersectional barriers such as gender, age, location, networking, access to internet manifested some of the challenges they already face accessing healthcare. Based on our findings, we have some recommendations. One is planning must be disability inclusive, involving persons with disabilities and their organizations. Comprehensive healthcare must be available during all time, including during emergencies, like rehabilitation services cannot be closed down for a few months during this type of disasters. Data disaggregation by disability in healthcare for healthcare is very much necessary for evidence-based decisions. At the moment, our HMIS is not disability inclusive. Universal design in building must be followed. We have a building code since 2008, but it's not actually followed either in the public or the private sector altogether, with some exceptions certainly. And research should consider disability inclusivity. Thank you from BIGD Bangladesh.
Thank you very much, Rifat, for that clear summary. Can we move on next to Abraham to talk about his work in Eldoret?
All right. Thank you very much, Julian. My research, which is a segment of my PhD work on disability in Eldoret, is basically, it brings together three debates, urban debates around disability in essence itself, and then urban informality, and within the context of a small and medium-sized city of Eldoret, where in this case housing is the sort of the common denominator. So the key message from this research is basically that most often voices of people with disabilities are usually not often not captured in specific manners relative to their needs in policy frameworks. So most of the time, all this is lumped together with sort of that mantra or slogan of marginalized communities. I think there's sort of a concealment there. So the key message is basically to unmask that marginalized communities development slogan or mantra, so that specific needs of people with disabilities are catered for and are captured in these policy frameworks. For instance, in this case, initiatives about housing improvements, slum upgrading. So yeah, so that is one of the messages. The other one is basically on the perspective of a small and medium-sized city, whereby you find that with governance systems such as devolution that are proving to be working very well in countries such as Kenya, there are these small cities that, with the trickle down of resources, they are growing very fast. For instance, Eldoret, for this matter. So, and they experience very unique dynamics as compared to the primate cities. For instance, Eldoret, if you compare within the Kenyan context. So they have their own unique, specific and development, that needs to be approached in a way that which is in essence is different from these primate cities. So more work needs to be done to these smaller cities or medium-sized cities in a way to unmask, or rather bring out voices of PWDs and then captured within the development frameworks. I think those are the key messages that my work basically passes across. Thank you.
Thank you very much, Abraham. And we already have a question from one of the participants about the devolution question. So we'll revisit that when we open up to questions. So if I can pass on to Vera now to talk a bit about the work in Nairobi.
Thank you so much, Julian, and good morning and good afternoon to everybody. I will briefly speak about the AT2030 work that has been undertaken in Nairobi between last July and this January. The work had a number of elements in it, but its aim was really to understand the current state of inclusive and accessible environments and infrastructure in lower middle income cities and how inclusive design can create an enabling environment for disabled people. So among other cities that the work was done in, one of them was in Nairobi. It was a really interesting and exciting piece of work in 3 phases. Understanding the current state of accessibility within the built environment in Nairobi, a city that is, Eldoret also being one that is developing rapidly, but within Nairobi and other cities, 80% of the infrastructure needs to be built in the next 20 years. So thinking about that right now. So understanding what has taken place in terms of the current state, and then really importantly, understanding the lived environments of lived experiences of persons with disabilities and the accessible environments or lack thereof. And the focus of our work, because the vast majority of Nairobians, 70% plus, live in informal or unplanned settlements, that was really the focus of the work, looking within those spaces and collecting photo diaries of people's lived experience on a day, and then also undertaking interviews with persons with disabilities, and then semi-structured interviews with stakeholders right across from the formal government officials and architects and urban planners, but as well as disability advocates and specialists, and running co-design workshops, really making sure that we understand as fully as we can that lived experience. And then finally, we had an action phase looking to synthesize the insights from these 2 phases and looping that into impact and intervention with the relevant stakeholders in the city, alongside, of course, the research outputs that are working on this. So because I have 2 minutes, Julian, I will go very quickly into some of the creative ways that we did this work. Storytelling was one of the main aims in the ways in which we did the kind of work, looking to understand, having interactive, inclusive, engaging ways of getting the information that we needed. And journey mapping as well, especially when we were having the co-design workshops. And just to contextualize, the co-design workshops were held with people with mobility impairments, hearing impairments, and visual impairments. And we held those separately, learning from some of the other cities around how to try and understand the different nuances that could exist with different disabilities. And I think that has already been raised by our colleagues from Bangladesh and others about making sure that we really understand things in their unique nuances. So maybe just the key findings that we found, there was many others, but the intersectionality also came up in the conversations that we were having, so that the policies and laws around inclusivity and accessibility, which already exist, should also cater for special groups within persons with disabilities. That was maybe a less obvious finding than the one that was already that laws and policies exist, but the implementation has been piecemeal. There was also a strong push amongst all stakeholders, including those from government, about pioneering good practice modeling on universal design, but also calling out poor design and the individuals and groups involved, and perhaps actually actively legislating that rather than tossing that aside, and looking at creative things such as scoring systems or tools to assess and certify the type of construction or design that needs to take place. And then in conclusion, and I think this was not in my presentation, but I thought it would be interesting to state that the work that we did fed directly into some other funded work by the Royal Academy on inclusive and integrated infrastructure. And it's a framework for a guidebook for working in fields related to infrastructure and informal settlement upgrading in Kenya. And at that moment when the work started, inclusivity did not actually explicitly include persons with disabilities. So that was included in that. It was launched at the World Urban Forum, which I think a few of you went to. but essentially it's been something with the Architectural Association of Kenya, Arab, the K Concrete Design Initiative. We're working with the different departments at University College London as well. And essentially, and the working with Slum Dwellers International in Kenya. So it's intended to be used when developing policy and planning and designing and implementing of infrastructure upgrading projects in low-income communities in Nairobi. I think that's it for me for now. Thank you.
Thanks very much, Vera. So I'd just like to pass over to now. We're very happy to have Ahmad Rifai from the Indonesian NGO Kota Kita, which has done a lot of work in Indonesia around inclusive urban planning. And Rifai has looked at all the presentations and been listening to your pitches and is going to offer some reflections and pose some questions that are raised across the presentation. So Rifai, can I hand over to you now?
Thank you, Julian. Hi, everyone. First of all, I would like to thanks for this wonderful opportunity to join with the international planning, international panel, and we are all working on this very important issues around inclusive planning in the city. Allow me to introduce myself. I'm Rifai from Kota Kita Foundation, an Indonesian NGO working actually very broadly in participatory planning and design of our cities broadly. So jump to the presentation. I don't know whether this is like a discussion or not, but I would like to reflect, but it relate to my current kind of also experience working in these issues, and I reflected from our presentation that there has been kind of I identify the directions of the advocacy of or advocacy movement on disability issue. For the first, for example, the first side is that it's that there is a notion around advocacy toward directed toward government policies related to states, for example, especially related to public services, to say, for example, to better understand the accessibility, especially for people with disability. For example, the case of health services in Bangladesh, for example, it's also appear in many parts of the world, including my country, Indonesia, where I live. PWDs or person with disabilities group and organization have made many efforts to ensure the accessibility of health services and facilities for persons with disability, for example. Also, for example, the Pong highlight about the policy tools that Pong presented already have also the direction to influence the government policy for sure in the context of policy planning, for example. Of course, not to forget also about the importance of the note from Pong about the importance to promote collaboration between parties in the city, for example, public-private partnerships. I would like to also say about the second area where I would like to say that there are a layer of advocacy where it's about encouraging the participation of private sector or to participate in the emerging issues of inclusive planning and open space for persons with disability, for example. Like also presentation from Pong, for example, in the context of smart city, which focus on the role of technology helping to create inclusive city. There must be like participation of the privates and a technology provider is really important to make sure that that's going to be very contributive for the process of advocacy. This includes also what's being done in Kenya around housing issues, and in advocacy relation must be interact with housing providers, for example, or housing developer and providers of rented housing, for example. But not to forget as well, and in our work, say, for example, in Kota Kita, there are another layer where people work on the issues of disability and inclusive planning, working together hand in hand with community-based and grassroots organization to kind of develop like pilot project in the community, and then by also strengthening the raising awareness in the level of the grassroots. that's my point, I think, from what I would like to share. But probably just one provocation for question that I would like to share for everybody here regarding, like, maybe it's directed specifically to Pong as well, but probably in the models of where we actually working, because we have, so for example, our standpoint is from the non-government actor. We usually see a lot of policy tools or policy kind of toolkit prepare for intervention with the government kind of planning processes. But what I would like to ask, whether there is an experience from this kind of presenters, for example, the aspect of how, when we kind of our recommendation, especially if it's also want to kind of provide recommendation for policy tools, for example, how can we find a better way to integrate our recommendation with existing government planning processes and mechanisms, for example. That's just my final kind of provocation. Thank you very much, and give it back to you, Julian.
Thank you, Rifai. So I think in terms of Rifai's feedback, he was thinking about the different entry points for policy advocacy with the state, with the private sector, and with community and grassroots engagement. And I think that the question he leaves us with is, what are the sort of more effective entry points for this kind of policy advocacy and actually carrying through policy into action? So just to open that up to the panelists, if any of you would like to make a response to that question around policy advocacy and the different routes for that. If you want to jump in there, you can put your hand up. Otherwise, if people don't have a direct response to that, we can revisit that, and we have some other questions that have already popped up in the chat.
হ্যান্ডসটা কোথায়? উল্টা রিয়াকশন।
Rifat, please.
Policy advocacy is very important, and it has to be done at both, practice and policy level. And we really need to, I agree completely with Rifai that we have to engage different players at different states, at different tiers. The thing is that one of the way to make policy advocacy more effective is to have evidences. Some of the problems countries like ours face is that there aren't adequate research done on different areas involving persons with disabilities. And we really don't have evidences. Like, say, for example, in employment, Bangladesh generates quite a lot of information. In health, quite a lot of information. In education, quite a lot of information. But many of these information doesn't have specific information for children with disabilities or persons with disabilities. Rifai has mentioned that I know that the non-communicable disease control of the Directorate General of Health Services, very recently they are trying to make some of their service centers physically infrastructure really accessible. Many of the doctors, they want to do it, but the problem is because so many people are involved here, like the constructions are done by engineers, civil engineers and architects, and they actually don't follow the building code. So the problem is so huge. Policy advocacy is necessary, but somehow it's not working as it should be. And there is very much need for evidence generation to make policy advocacy more effective.
Thanks very much, Rifat. So emphasizing the importance of research, which I think is probably a welcome message for all of us here. I don't see any other hands up immediately in response to Rifai's question. So maybe I can throw this open. Oh, sorry, Pong.
Yes, so let me respond to the last one about strategies. G3ICT and World Enabled have worked with other organizations like World Economic Forum and other city alliance. And one way for us to make sure that policy interventions are effective is by making sure that you work with different parties. For example, you work with the government, you have to first, of course, have a landscape of what is their capability, what are they able to do, and what are they not able to do. And that's where we come in. We try to supply the technical expertise that they probably need, and then find other partners who might fund a program to increase their capability. Similarly, you have to do the same thing with organizations of people with disabilities. If you want them to be your champions about inclusion, you need to also strengthen their capacity, like what we did in ASEAN. So from the very start of developing the Enabling Master Plan, what we did was encourage organizations of people with disabilities to be part of the design process. They are part of the discussion, and they're also presenting to government officials what they think about disability issues. And throughout the process until it was adopted, they were there. And so because they were part of the whole process, they had a sense of ownership. And it was a lot easier for us to convince them that, why don't you help us roll out the regional plan of action to your countries? And so we find funding for them, we help them. And then at the same time, they're also working with the governments, the national governments and local governments. So it's easier for them because they know the process, what are in the master plan, and government also were part of the process. So it's easier to have a synergy when you work from on all sides. Same thing with the private companies. Sometimes they want to do the right thing, but they don't know how to do it. So you need people who have the expertise. That's why we have also organizations like the International Association of Accessibility Professionals, who are the ones who might need to fill the gap in terms of capability of different organizations, specifically private companies. So you can work on advocacy, but at the same time, you have to also increase the capacity and capability of all the organizations that you want to work with. And it cannot be just with one organization or one sector. You have to work with them all at the same time.
Great, thanks very much, Pong. So an important message about having a strong institutional understanding for the advocacy and actually understanding the sphere of influence of different organizations, and emphasizing the centrality of organizations of persons with disabilities in those advocacy processes. So we're quite tight on time, and I know there were some questions from participants. There was a question from Andrea Rigon towards Pong, but I think he's already spoken a bit about the involvement of the private sector. So maybe we can look at his other question, which was to do with the processes of devolution in Kenya. And I think that's relevant to Abraham, who it was posed to, but I think actually it's also relevant to Vera. So Andrea asked, I wonder if the devolution is also an obstacle rather than an opportunity to the advancement of disability rights, because it fragments the advocacy that should powerfully influence 47 different counties of government. So I guess this is a question which is relevant both to Abraham from the perspective of secondary cities, and also to Vera thinking about Nairobi in the context of that devolution. So maybe I can open this up to both Abraham and Vera.
Oh yeah, thank you so much, Julian. And I think I will have, yeah, it is true that possibly devolution does rather desegregate or rather tends to put to break that circuit, that concerted effort of championing for disability rights. So that is on one side, but on the other side, you realize that in itself, devolution it trickle down resources basically closer to the people and power. So I remember this one instance whereby I was engaging this participant, and at this point juncture, he told me there was a time he actually tasked the governor of that region who was in Gishu about an issue of accessibility. So you could relate that power in itself was very much closer to the people as much as the resources. in terms of representation in the local assembly and what have you. And on that aspect of desegregation, you will have to appreciate also that all these various counties are diverse. They have rich elements within their own. So when all these 47 counties possibly come together and share these ideas, maybe through convenes such as conferences, for instance, the annual devolution conferences, whereby these counties come together to share ideas. I feel in sharing that knowledge and the diversity that is in the country, because all these counties do possess various rich, diverse elements. So in as much as, yes, I do agree that devolution breaks that concerted effort to champion for the disability rights. On the other side, it does empower them and brings resources closer to them so that they can be able to put leaders, or rather those in positions of power, to task, and of course representation at the local assembly. So yeah, I think that could be that is my response. Thank you.
Thanks very much, Abraham. So I see we're almost at the end of our time. So if I can hand over to Vera, if she has any responses to that as well. And then after that, maybe Michaela can just add some final words and wrapping up.
Okay, I will keep it short. I really think, as someone who lives in Kenya and is a benefit of devolution, in many ways, devolution has institutionalized certain things that perhaps needed to be institutionalized, such as planning and design in Nairobi, for example, is much more set within the Nairobi County level, maybe perhaps, and it might have been within the certain ministries as well. But the point, and someone has also brought this up in the notes, is that irrespective of that, perhaps something that we could tend to lose with that fragmentation is ensuring that the design of development plans or certain policies that may be implemented at county level are actually being implemented in the same way. So for example, ensuring that persons with disabilities are key stakeholders isn't coming from the top down. It's being, potentially is being decided at that county level. And then that essentially embeds particular issues that need not to be embedded, such as poor design. Something else that I think devolution has the opportunity to do, and this is moving to other ways in which to implement policy, is in the notion of education. And this came up really, really high in terms of the conversations that people were having around inclusive and universal design, and the elitism that exists within it in terms of architecture perhaps being the way in which people are going in. And the reality is that the majority of construction is informal or unplanned. So actually going to the technical colleges at the levels they need to be got to, so as to make sure that, and embedding that adjustment to curricula on universal design there. That's what I'll say to that. Thank you.
That's great. Thanks, Vera. So we're at the end of our time, but I'll just share a couple of quick words to close. So firstly, thank you everybody for joining us today. Thank you to our panelists for your contributions. It was really fascinating to view the presentations, but also then to hear from you today and be able to discuss them in more depth. And also thank you to our participants for joining us and asking questions and engaging in the conversation. So I just wanted to mention a couple of brief points that I think have emerged from this overall discussion that seem to be kind of key areas to maybe for further research, for action, that maybe we can take away and think about and hopefully continue the conversation. So the first was about evidence, that we need evidence to back up our advocacy claims, and we need evidence to influence policy. And that evidence needs to be disaggregated, it needs to be intersectional so that it reflects the diversity of disability and also includes and considers other marginalized groups. I think we also need to think about the relationship between the local to the national or the global. So we talked a bit about devolution specifically, but I think there's something here around understanding how local government policies and national government policies can work together. And I think there are examples of where local government leadership has been quite successful, and we can learn from those. we also need the leadership of people with disabilities. So that means including people with disabilities as active participants in urban planning, but also ensuring that people with disabilities are able to access employment in planning sectors and in government, so that we have leadership that reflects the diversity of our population. And that's one of the best ways to ensure that inclusion is embedded in all of our urban development. And then lastly, I just wanted to mention the sort of multiple sectors that we're engaging with. So talking about the private and the public sector and how we find ways to work between the two. You know, we've had some presentations that are focusing much more on the public sector, others engaging with private sector. How can we bridge those gaps and find ways to collaborate and work together, as Pong said. So I think that's it from me for a really quick sum up. Thank you again to everybody. And we just wanted to say on behalf of me and Julian that we're really keen to continue this conversation, both with panelists and participants. So if you're working in this space and want to talk further, please do get in touch, because we think there's lots more work to do, and we're keen to collaborate with others that are kind of working towards the same goals. So thanks very much, and I'll close there.
Thank you, Michaela. Thanks, Julian.
Thank you all.
Thank
Very
you
nice
all.
to see you all. Bye.
Nice to meet you,
Thank
Paul.
you.
Thank you.
Thank
Nice to
you.
meet you too. Bye.
Bye.
All right, thank you.